So here I'm going to show you how I'm determining an herbal formula that combines the research from China to get immunity against the COVID-19 and also treat the person as a whole. So my patient is a 27-year-old man with a main complaint of allergies. So what are the symptoms of your allergies? When you have the allergies,
Well, itching.
itching in the eyes or
Yeah, I would say sort of around my mouth and eyes sometimes, but that's pretty rare. The main thing is I would say sneezing and sniffling.
sneezing and runny nose. Any postnasal drip?
Yeah,
Do you cough that phlegm or do you just have it stuck in your throat?
neither. I would say I swallow.
Okay. Do you have any sinus pressure? Like feeling of pressure here or headache?
No.
And you don't have any lung symptoms?
No. Beyond sneezing.
Sneezing is kind of upper respiratory. Any kind of lung symptoms in the lower respiratory?
No, I wouldn't say so.
Any headaches?
No.
Appetite is good.
Mm-hmm.
It can be good, too good, or no appetite, or so-so.
I'd say good.
Do you have bloating after you eat?
Depends how much I eat, but if I eat a lot, then yeah.
And usually you eat a lot. Every day you have some bloating?
No. It depends on how big the meal is, but if I eat a lot, then I'll feel discomfort.
So how often do you eat a lot?
maybe once, maybe twice or 3 times a week.
3 times a week. Do you go to the bowel movement every day?
No.
So it's every other day mostly.
Yeah, I would say every other day.
Is your bowel movement soft and formed, or does it tend to be hard or loose?
Just normal bowel movements.
Normal bowel movements. Is it complete, or do you have to stay quite a while to get?
I'd say complete.
What's your energy level?
Pretty
From
good.
1 to 10.
I'd give it like a 7.
Good.
Mm-hmm.
In your temperature, do you feel more towards the hot side or more towards the cold side? If you had to choose, like what is predominant?
Yeah, probably hot.
So it's but you're not really hot. It's just neutral to hot. You would call it, right?
Yeah.
You don't have any abnormal sweating.
No.
Urination, you don't have any color, odor, or anything in your urination.
No.
And no frequency.
No.
Also, you don't urinate at night.
No.
Sleep, do you wake up in the middle of the night?
Yeah, sometimes.
Sometimes you wake up and it is easy to fall back to sleep.
Yeah.
But you still don't wake up rested, or you
Depends on when I go to sleep. If I go to sleep too late, then I don't wake up rested.
So how many hours do you get a night?
Maybe 7.
Okay. In your age, I think you should get an 8 hours. Emotions, do you tend to be more just stable, a little bit anxious? In anxiety, do you tend to be more on the irritable side or more on the depressed side?
More on the irritable side, I would say.
And you feel a little anxious in general?
Not really, no.
So, I'm going to look now at your tongue. So, I'm looking at his tongue, and I see, first of all, my teacher told me, look just at the center of the tongue at a circle about the quarter size and determine the color there. So I looked at his tongue and I saw that the color was pink. It was not red, it was not pale, it was pink. And then I had to decide how much purple is in the tongue. So I had three choices: mild purple or no purple, moderate purple or very purple. So I decided it's mild to moderate purple. And then I saw that looked at the shape of the tongue, and the shape was swollen with tooth marks. And when he showed me the back of the tongue, I saw engorged veins. Then I looked at the coating, and it was yellow and slightly greasy, thin. Based on my intake and on the tongue, I can begin to make a diagnosis. So my diagnosis is that there is a little heat, phlegm, there is some phlegm or dampness, and there is some stagnation. The basis of my diagnosis is that he has postnasal drip, he has greasy tongue coating, and he has some bloating. That can be explained by dampness. Heat, he is irritable, he feels hot, and he has a little bit red in the tip of the tongue. So I would say, and stagnation, there is a little purple in the tongue, mild to moderate purple, and there is again stagnation showing in the bloating. So the dampness, then there is wind, exterior wind that expresses itself in the itchy eyes and in the sneezing. So my treatment principle is clear heat, remove stagnation, disperse phlegm, calm the spirit, to increase immunity. I'm going to use the formula used by formula used in China for the COVID-19 for increasing immunity, that includes the astragalus, the atractylodes, the psyllar, and the honeysuckle. And I'm going to add herbs that treat this particular man. So that's it.